Hi ladies, this is Lauren from LD Insights, and I'm here today to start a Life After Cancer series. And to start this Life After Cancer series, I want to talk to you today about the side effects of chemo. Just to give you a little bit of background, my diagnosis, and I want to read this to you, make sure I get it right. My diagnosis was invasive ductal carcinoma of the left breast. The treatment for this particular breast cancer was two different types of chemo. I had 4 weeks, every 2 weeks, adromycin and cytoxin chemo. And after that, I had 12 doses that was given weekly of paclitaxel, also known as Taxol chemo. I want to talk to you about the side effects that affect me even to this day. I was diagnosed in 2014. The cancer was removed in 2014. I had reconstruction, total 14-hour surgery at one time. After that, I went through the AC chemo and then the paclitaxel chemo. And after that, I went through radiation. But I also, within that 14-hour surgery, I actually had removal and reconstruction in a 14-hour surgery. And I did the dip flap reconstruction. So, fast forward, 5-6 years later, I have neuropathy in my hands and my feet, which makes it a little bit difficult sometimes to wear heels for a very long period of time. When I am writing, my hands or my fingertips get a little numb from writing. Those are the side effects most notable from the chemo. But after chemo, I had what they call Chemo Brain, which gives you foggy brain and makes it a little bit difficult for you to, my thinking wasn't as sharp as it would normally be. I also went straight into menopause. Sometimes chemo causes women's cycle to stop. However, in my case, chemo pushed me straight into menopause. And not only did I have chemo brain, but now I have foggy brain from menopause. I have hot flashes and night sweats and mood swings and weight gain. So a lot of things that my body has actually gone through from chemo, they have just compiled one thing on top of another. I was working a job that I really enjoyed. I was an assistant manager in the marketing department, and which required a lot of travel at the time that I was actually diagnosed. After being diagnosed, I went through the removal, reconstruction, chemo, radiation, all of that. And when I came back to my job, my body took a hit from the chemo, and I wasn't really able to travel as much as I would normally travel. I wasn't able to stay up late at night and complete my work or work harder the way that I was working prior to going through cancer and chemo. With that said, I left the job that I absolutely love. I think it was my calling almost to be in marketing. I really loved the job. The pace was too fast. And I didn't think my thinking, I wasn't as sharp as I was post chemo as I was prior to chemo. So I decided to change jobs. So I took another job with less pay. I became a coordinator at the company that I worked for. And after that, I went through this thing and I experienced costochondritis. Costochondritis is a condition where the rib cage or the cartilage that connects the rib cage to the sternum bone in your chest gets inflamed. I had never had this issue before, never experienced it before. I went to the emergency room thinking that I was having a heart attack. I get to the emergency room. They say that it's costochondritis, it's inflammation. There's nothing they can really do for it. They just have you take ibuprofen or anti-inflammatory for it to go down. Well, I started thinking to myself, I wonder if there are other breast cancer survivors who actually had the dip flap surgery. Are any of them, and if you guys are, please reach out and let me know if you have been diagnosed with costochondritis, because prior to this, I had no problems with costochondritis or my chest at all. And if you have had the dip flap surgery, you know that they have to remove a piece of the rib in order to connect the tissue to a blood source in your chest once that particular surgery is done. I've actually had 2 bouts of inflammation since the surgery where I had to go to the emergency room because I was feeling a little uncomfortable and did not know whether it was a costochondritis or if I was actually having a heart attack. But that's neither here nor there. That's just another side effect that I think that has happened to my body since cancer. I have gone through depression, PSTD. I was diagnosed with PSTD because so much was going on. I think getting through my cancer journey at the beginning, I thought that things would just go back to being normal, which helped me get through the radiation, the chemo, and all of the things after surgery. I thought that things would go back to being normal. I held on to that, thinking that my life would be the same, that I would be able to do all the things that I was doing prior to cancer. However, nobody really prepared me for this post-cancer thing. I mean, like, not at all. I went through the menopause, and after menopause, and after, well, not after menopause, I'm sorry, after chemo, and after they removed it, they give you a post-cancer drug. The post-cancer drug, you'll either take a tamoxifen or a anastrozole, and both of these particular drugs are hormone inhibitors. And this is strictly for individuals who have been diagnosed with ductal sarcoma. The ductal sarcoma was induced by estrogen. The more estrogen my body produced, the more it caused the cancer to grow. So you're given this post-cancer drug of anastrozole or tamoxifen, and I think it's Amatros, maybe another name for this medication, but in particular, I started off with tamoxifen. Tamoxifen is given to women who still have their cycles. Well, after not having a cycle, they switched me from tamoxifen to anastrozole. So I want to speak to you guys about anastrozole. After going through all of the chemo, the radiation, thinking life was going to be the same, things were going to be great. No, ma'am, they were not great. And even now, 5 years, 6 years post-cancer, I have been taking the anastrozole, and I want to tell you about the side effects of anastrozole. And I'm only going to deal with the ones that I have particularly dealt with. Numbness and tingling feelings. So it induces the numbness and the tingling from the paclitaxel chemo is actually what caused the numbness and the tingling in your feet. It's called neuropathy. And it's also a side effect of the paclitaxel chemo, but it's also a side effect of anastrozole. I am actually reading the side effect pamphlet that they give you. The side effects that I have actually experienced are depression, mood changes, tired, weakness, hot flashes, which sounds like menopause. So a lot of this kind of mimics menopause. Joint pain, trouble sleeping, anxiety, and weight gain. Okay. So you have weight gain as well as sweating a lot, which sounds like menopause and hot flashes again. Um, so it's kind of, oh, and this is the one thing that I really want you guys to know. One of the greatest side effects of anastrozole is bone density loss. I have experienced the bone density loss and am in the early stages of osteoporosis, which is called osteopenia. I broke my ankle in 2018. I broke my ankle in 2018, and after going through chemo and being on all of the post-cancer medication, they require you to get a bone density test every year for the next 5 years. I got my bone density test in April of 2018. Everything seemed fine. But in July of 2018, I broke my ankle. After I broke my ankle in July of 2018, I went back in 2019 for my bone density test. And that is when they saw I had loss of bone density. So now I am required to get a shot every 6 months, Polaro shot, which is like a cancer or bone building shot I have to get every 6 months. But not only do I have to do that every 6 months, I also have to take a oral calcium tablet um, within my regular vitamin regimen. So I say all of that to say that this cancer journey, um, it really, I won't, it, I can't say it, cancer stops. I can't say that. The cancer has been removed and gone. However, your life does change. And I think it is the change after uh, that needs to be talked about. It's like, how do I move from being this outgoing, energetic, sharp thinking, smart, intelligent? I mean, I felt as though I was all of these things prior to cancer, but post cancer and all of the medications and menopause and um, all of the transitions that I went through after cancer, the depression, the mood swings, and I guess because I never really dealt with, uh, I felt like I was going through cancer and things would be great. I'd be on the other side of this, my body would be better, and my life would get back to normal. Um, and going through the changes and the illnesses, I have since cancer and everything that took place, I have moved back to Atlanta, which is where I'm originally from. I was diagnosed with cancer when I lived in Dallas, Texas. I lived in Dallas for 6 years, and even after cancer, I was there after cancer for a year. But when I experienced the costochondritis and I realized that I did not have any family in Dallas, it caused me to have to make another hard decision to leave Dallas, and I really enjoyed living in Dallas. But it caused me to make a decision to come home because I had no family in Dallas. So my life after starting this channel, and now I am relaunching this channel, just so that I could help one person at a time. That is the mantra for LD Insights. Is to encourage one person at a time. And I want to encourage you, even as I go through, and we go through this thing together, that if you are experiencing some things after post cancer, taking the medication, things you want to discuss, hit me up on this channel. Subscribe to my channel, because this is just the first thing that life after cancer that we're going to talk about. Just the side effects of AC chemo, paclitaxel chemo, and the post-cancer medication, the anastrozole or the tamoxifen, whichever one that you are on. I was doing a little bit of study the other day, and the side effects of the anastrozole was bone density loss and vaginal dryness. But the side effect of the tamoxifen, long-term effect, it caused uterine cancer. And I was on this channel. I'll try and remember to put it in the description below. some of the links of other channels that you can go to where they're talking about the difference between these two medications that have been prescribed to women that had ductal sarcoma. And I think it's called DCIS, maybe the initials that they use for the ductal sarcoma diagnosis. But if I can shed a little bit of light on what my life has been like and share with you guys that are starting this journey. For those of you that are starting your cancer journey, I want to set expectations for you so that you're not blindsided by the fact of thinking that life is going to be normal. Actually, I consider this my new normal. So my new normal requires me to use all of the tools in the toolbox because I have foggy brain and it never went away. My cognitive thinking is not as sharp as it once was. The tools that I have in the toolbox, um, I use my calendars to help me remember dates and appointments, things that I used to could just, I would know off the cuff, things that I had to do. I use the alarm on my phone um, to alarm me 30 or 40 minutes prior to whatever it is I need to do next. I make to-do lists and check off those to-do lists. Um, but for a while, I was aggravated, uh, agitated about the fact that I could not remember things that I once knew, that I didn't feel as sharp as I was before, um, that my body didn't feel the same. My joints sometimes hurt. And I think arthritic pain is one of the other side effects, or stiffness that anastrozole may cause. But these are just a few things that I wanted to come on today and share with you, young ladies. Like I said, if you're starting this journey, start this journey with three things in mind. Get one thing that you want to live for in mind and stay focused on that one thing. When times get hard and you just feel like you may want to give up, think about that one thing that continues to cause you to keep on keeping on. And secondly, establish a relationship with the Father, because it is through prayer, my relationship with the Lord, that has allowed me to even get this far and know that God is a healer, He's a restorer, He's a reviver, a renewer. Because there has been a lot of things that has had to be restored to me. My job, the income that I left from being an assistant manager all the way up until now. It was by the grace of God that the Lord opened up doors for me to walk into and not miss a beat, and have been set up so that um, my financial status has been good. It wasn't like it was when I was in marketing, but I haven't missed a beat, and it's better. I got the stress out of my life because I wanted to look at life differently. I respected life differently after going through cancer and chemo, and I try to eat right. Um, and it doesn't mean you're not gonna eat junk food, but I try not to think about allowing me, or think about me just having to lose weight. That has not been my focus anymore because of the post medication and everything else that I've gone through. It has helped me realize that it is going to be difficult to lose weight. It is not impossible, but it is difficult. So I have accepted that it is difficult, and this size 10 that I used to be, it may come back slowly, but it's not here right now, and I'm okay with that. As long as I maintain a healthy weight and continue to exercise at least an hour 3 times a week. Um, I try and do a Zumba class, find exercise that's fun, and sometimes I can tell when my body's just a little bit tired, even when I go to my Zumba classes. But I had to find things that were fun for me, and I would encourage you to do the same. We're going to talk about a lot of things on this channel, and I kind of made a list because I don't want to. Let's go back to the hormone inhibitor though before I sign off. The hormone inhibitor causes your body not to um, produce estrogen. In fact, I'm going to try and see if I can bring all of this together. Number one, I went through menopause. Menopause caused my body not to be um, producing estrogen. And then I'm on a hormone inhibitor, which causes my body not to produce estrogen. But what they don't tell you, or my lack of knowledge, you need a certain amount of estrogen in your body because estrogen does help your bones, which is how I had what they call my first fracture. Now, in the name of Jesus, I don't plan on having any more fractures. We taking care of ourselves and we are pleading the blood of Jesus over this body, the only body I got. And I am going to take care of this body. But after that first fracture and being diagnosed with osteopenia, I am doing all that's in my power, eating right, taking the calcium supplement so that I will not incur any additional fractures or any additional bone loss. The other thing that was disheartening about this is that initially I was told that I would only have to be on anastrozole or the post medication for 5 years. I went back to the doctor last year, and the doctor says now, oh, studies show that you have a better chance of the cancer not coming back if you stay on the drug for 10 years. So, my question is, A, do I stay on the medication for 10 years, um, causing the cancer not to come back, and knowing that this medication causes bone density loss? So at every turn, I'm having to make decisions about my life and what the next phase of my life is going to look like. So I'm taking control of my own life, my own happiness, and yes, I'm going to continue to take the anastrozole. However, I will be taking the anastrozole, being very informed about it, watching my body, staying on top of the doctors with this bone density thing. If there is an additional bone loss, then we will have another conversation in regards to what other medication is out there that can be replaced with this anastrozole if we have to do this another 5 years. I am in my sixth year now, if my math is correct. That's me doing math in my head and not calculator, so that could possibly be wrong too. But I just wanted you guys to know that this osteopenia, the vaginal dryness, for those of you that are married, um, there is a product called Replens that will help with the vaginal dryness for those of you that are married and are speak to your spouse, because intimacy is a very important thing in marriage. I am not married, but I want to be able to minister to those of you who are married. Uh, have a serious conversation with your spouse, because this after post cancer thing, it not only affects you, but it affects your relationship with your husband. So I would encourage you to have that conversation, explain what's going on, and throughout this entire time, you kind of learn it as you go, because when the doctors sit down and have a conversation with you and tell you about what it's going to be like after cancer, nobody really prepared me for the fact that my body was not going to be the same, that I was going to gain weight, that my joints were going to hurt, that I could sometimes get down on the floor and have difficulty getting up. That is just the truth. My muscles or my ligaments, I don't even know what to call it. All I can tell you is that some days are better than others. I've learned to manage the bad days and make sure that I do what needs to be done to get through. Call on the name of Jesus, do whatever it is I got to do. But life after cancer is really different from how life was prior to cancer. So I hope that I have covered, I'm looking at my notes because I want to make sure that I've covered everything that I wanted to cover in regards to um, the side effects of the drugs and the things that you will have to be conscious of. I love to roller skate, but I have not been roller skating uh, post cancer, and especially after that fracture. I don't want to operate in fear, but that thing is real for me. So I want to go roller skating, but I'm scared if I go roller skating, I may fall and break something. So this is a new normal, life after cancer, and that is what we're going to be discussing on this channel. This is just the first first part of the life after cancer series. Like I said, we're going to call this piece the side effects of chemo and radiation. That was one of the side effects I did not talk to you guys about. I'm so sorry. Radiation. I actually had my reconstruction, and then I had radiation after my reconstruction. I wish that that had been explained to me too. After radiation, prior to radiation, I had perfect symmetry. The left looked just like the right. There were no problems. I went through radiation, and after radiation caused my perfectly matching breasts to shrink. Now they are asymmetrical. One is larger than the other, and the only thing you can do in that instance is to go back, have surgery again, and this is the realness of this thing. You either live with it or you go back, see if you can do a fat transfer, or see if you can do breast lift on the opposite breast. And at this point, I've thought about those things, not sure how I would like to handle that, but they are things that you think about. It's just a lot of things that we think about after the fact that nobody really talks about. I would encourage you, as I am looking for um, a breast cancer survivor group. I do know I'm in Atlanta now, and I do know that Piedmont Hospital has a breast cancer survivor group that you can join. And if you're in another state, I would advise you to speak with your oncologist to find out where you can join a group, because going through this, people that have not experienced this, they will listen to you talk about it, but they don't actually get it. Your family, your friends, they love you, they want to help you get through this, but they don't actually get it. And there is only so much that you can describe or say to a person where they actually grasp or understand what you're talking about or why you feel the way that you feel. Um, and depression really slipped up on me. I thought I was doing good until I began to have crying spells, and I could not figure out what was causing the crying spells. Why was I being agitated about everything and was so sensitive about everything? Well, I was sensitive about everything because throughout this cancer journey, I have had my boxing gloves on from the day that I was diagnosed all the way up until now, 2020. It wasn't until last year, 2019, the end of the year, that this emotional, I began to go on this emotional roller coaster where I was having crying spells and I didn't know why they were coming or how they were being caused. So that is another piece of life after cancer that we are going to discuss on this channel. Just to give you an overview, we will be discussing depression, PTSD, clothes, wigs, even how your hair grows back differently and how to manage it if you can or if you can't. But we're going to talk about a lot of things on this channel that post cancer that you may not get in the doctor's office. So I hope that you have enjoyed the amount of information that I was able to give you in this particular series, this first series of Life After Cancer. And if you want to learn more, please subscribe to my channel. Excuse me. please subscribe to my channel. And I'm going to try to put out videos every Tuesday. It will either be a video regarding life after cancer or another series that I am going to do, which is going to be called Insight Inspirations, because I know that through this journey, sometimes you are going to have to be encouraged to get from point A to point B, to just get through this. And on this channel, we're going to talk about the realness of it. And with that said, know that foundational scripture for this channel, though, is 3 John, the 1st chapter, the 2nd verse, which says, I wish above all things that you may prosper and be in good health. Until next time.